Good evening. Welcome to the Elrod Center for Family and Community on the campus of Ouachita Baptist University, where Dr. Ben Sells is our president. I'm Lewis Shepard Jr., Special Assistant to the President here at Ouachita, and your facilitator for this evening's event. Also, I serve as pastor of Greater Pleasant Hill Baptist Church, a role that I've served in for the previous 20 years, and as a member of the Arkansas Hospice Foundation Board. It is great to be here this evening as we discuss the topic, Black, Brown, and the challenge of dying well. What exactly is Black, Brown, and the challenge of dying well? African Americans, as well as Hispanics and other minorities, are at risk of not dying well. Historical lack of access and substandard health care for minorities over time has led to a general sense of mistrust in many aspects of our modern healthcare system, including the understanding and utilization of hospice care. But change comes with understanding. Knowing what hospice care is and how to assess it can help our minority populations and their families to receive the comfort and respect they deserve when life-limiting illnesses occur. This online workshop is designed to help bring awareness to all our communities about the problems and available solutions for minorities and end-of-life healthcare. Arkansas Hospice is presenting this program, which is made possible by a grant from the Rebsamen Fund. Our panelists for the evening have distinguished themselves in careers, and not only just serving others in the prime and wellness of life, but also serving those with their families toward the end of life. Our first panelist is Linda Bateman, and Linda states that growing up in a family and community where education, health, and human service needs of others was always seen at the forefront, there's no speculation as to why she has spent the vast majority of her career in the field of helping and serving others. Over the years, Linda has built an extensive network of collaborative partners through her community involvement and leadership in Pine Bluff. Linda is the volunteer coordinator for Arkansas Hospice in Pine Bluff and Monticello areas, and she's also the executive director of Youth Partners, a nonprofit that's an affiliate of United Way Southeast Arkansas. There she manages Dolly Parton's Imagination Library for Jefferson County and the SOS, Students with Opportunities to Soar program. Linda graduated from Pine Bluff High School, and she's a proud alumna of the University of Arkansas at Pine Bluff, graduating with a Bachelor of Arts degree in criminal justice. Linda has had many jobs serving as with the Department of Corrections for the state of Arkansas for 9 years. She's worked for SCAN for 15 years, as well as Arkansas 211, a statewide health and human service resource information center that was initially located in the Donald Reynolds Community Service Center in Pine Bluff. When Linda began working at Arkansas Hospice in 2011, she noticed the disparity among African Americans using the hospice care there. She found out that unless someone had personally experienced it, they knew very little about hospice and what it meant. She was that same person until her family was referred to hospice for her mom. Linda now takes advantage of any opportunity to educate others on hospice by sharing her story, desiring to help others despite the myths. Linda has one daughter, Alindria Carol Jordan. She and her husband, Orlando, are parents to 4 children, Ava, Landon, Olivia, and Octavius. The Reverend Alex Brown is the pastor of the Mountain Nebo Baptist Church, North and South campuses in Yorktown and Monticello. He has been there for 25 years. Pastor Brown is chaplain with Arkansas Hospice, Monticello's office, a role he has served in for 4 years. And now, how can our listeners participate in this workshop this evening? Right now, questions can be forwarded to our panel discussion by visiting arkansashospice.org. At the bottom of the page, there's a link where questions and discussion topics for minority utilization of hospice can be submitted. Listeners can also submit their questions live during this program, but we encourage everyone to send in their questions now. I will start off our discussion this evening with a question to our panelists, and it's a time of reflection. And most of us remember the first important things in our lives, things that stand out and that will stay with us forever. So I would like to point this question, this query at both of you and ask you to share with us your hospice story and how you as a minority first encountered hospice care. And ladies go first. So Ms. Bateman, would you please start off this evening?
Yes. Well, I can go back and remember my first encounter was, as you mentioned, with my mother. She was diagnosed with a terminal illness. She had cancer. The cancer was in remission for about 8 years. However, it returned. And when it returned, we really didn't really know what was going on, but we knew her condition had changed. At some point, I have an older sister who was involved in her care. She talked her into going to another doctor. And you know how we sometimes trust our doctors, and she had been going through some complications for a while, but didn't necessarily want to get another opinion or seek a specialist in that area. And when she did, she found out that the cancer had returned, and she did chemo and radiation. And at that particular time, she did it for a while, but then she recognized that it wasn't helping. And so I remember the call from a nurse, and a meeting was scheduled. The first thing was, she said that I need to speak with you and your family. We need to talk about your mom's condition. Her treatments aren't working, and we need to talk about hospice. And I thought, first of all, hospice, I didn't know what that was. But I also knew that she mentioned that the treatments weren't working and that her prognosis was 6 months. And so I knew enough to know that that meant that she didn't have very long to spend with us. Well, during that meeting, I think there was a chaplain present, a social worker. One of the things I remember most, they were the most caring, compassionate people. My mother took it better than her family. She was ready. She knew that she was getting weaker and weaker after each treatment. And she really didn't want to tell us that. But so it was kind of a relief. And what she said is, I want to get on with living. I don't want to focus on dying. I think she left it up to us to figure that out. And at some point later, I knew that's what her thoughts were. It was an experience that I would recommend to anyone. First of all, I didn't know that hospice was a type of care. It wasn't a place you go, but my mother was home. We had nurses, had nursing assistants, the social worker. It encouraged us to make plans, things that we wouldn't have done originally, because who wants to do that? The chaplain was there to offer spiritual guidance and things like that. Even bereavement, if there's going to be grief on the end or the front end, they're there to guide you through that. And so what I learned that hospice was something that made her life really a celebration. We were able to really benefit from that. So that was my first encounter.
Wow, that's very, very personal when it's your mother. And thank you for sharing that with us this evening. Chaplain Brown, what is your first encounter that you remember with hospice and how it affected you as a person of color?
My first experience was also with my mom, and when doctors, my mom had a number of health issues, including kidney failure, multiple myeloma, diabetes, just a number of things that she was dealing with all at once. And of course, going back and forth to dialysis treatments, going back and forth to the doctors, it had become laborious for her. And I remember that there were several times that she would go to the hospital, she would get better, she'd go home, she'd go back to the hospital, she'd get better, she'd go home, and it was just a cycle. And I recalled one time when the doctors had called us in and told us that it was time for us to consider looking at keeping her comfortable, looking at hospice care. And I think one of the issues for us as minorities, I think that walking the line between dealing with the reality of a terminal diagnosis and our faith, it's a tightrope, and so we had fear. Of course, there was confusion, and of course, we didn't want to deal with that reality. But my mom got better that time. But during the course of that, we had an experience where my mom actually became non-responsive. She was in ICU, and the doctors had talked to us, and he said that they wanted to transfer her to another hospital. Well, my mom, within an hour or two, she came to, and we had told them that we wanted them to go ahead and do the transfer. Well, when my mom woke up, she asked us a question that I will never forget. She said, "Hospital, I'm not going to another hospital." And we told her, well, yeah, we talked to the doctors and they were going to transfer. She said, yes, but nobody talked to me. And I find that was a very eye-opening experience, because sometimes in the interest of trying to do the best that we can for our loved ones, we forget to ask them, what do they want? And she was tired of all the trips to the doctor. She was tired of the hospital trips. She was tired of all that. And so hospice, we put her on hospice. And of course, it was an eye-opening experience for me, because instead of her having to go to the hospital, she still had medical care that was coming to the home. It was an entire team of people: social worker, chaplain, nurse, CNAs. It was an amazing experience, and so we things went well, and even after my mom transitioned, the hospice chaplain continued. The bereavement staff continued to come and care for my dad for, I think, a little over a year after her transition.
You both have extremely personal stories, and is this what led you to want to become a part of this work?
Well, actually, that was not my doing. That was the Lord's doing, but that did prepare me for my work with Arkansas Hospice, which came about 5 years after that. And it definitely helped me to see things in providing care, in fact, chaplaincy care, from a perspective that I wouldn't have had if I hadn't gone through that with my mom.
What about you, Ms. Bateman?
It's kind of the same way. I had worked for a long time with volunteers, and I, of course, came as a volunteer coordinator. And I remember my interview and remember being told that, this is not really a job, it's actually a calling. And I found that over the years, it's exactly what it is. It's a calling. And so, and that's what I enjoy most about it, is that you're able to share with others about experiences and encourage others.
Thank you. The second topic that I would like to move to, and let me preface the question with a comment, and that is, often in minority communities, hospice is misunderstood. Comments such as denying food and medicine to patients. I've heard all of those stories. In your experience, how have minorities traditionally perceived hospice care?
Well, I found that it was either one of two ways. They perceived it was a strike of fear just to have the conversation. It made people uncomfortable, or it would give a sense of peace for those who may have heard about it, who may have had some type of either a shared story or a loved one themselves. But I found that it was a conversation that I had to have anyway, even with my family. And it's not a topic that people want to talk about. Who wants to talk about dying? However, it's something that one way or the other, we're going to have to face it. And so what I did find is that all the things you mentioned, people have a perception that, it hastens death. You're not going to be able to care for your loved one in the home. It means you're giving up. They're going to give them medicine that's going to, some people think that hospice hastens death. But those are things that I took time to share with them, is that you need to learn more about it, because even when I didn't know, I didn't know about it. But when I would tell people about it, and you would hear things about, they don't let you feed your loved one. Well, there comes a time when your loved one may not be able to eat. You have to make a decision whether they're going to choke if you're force feeding. The pain medication. Well, my mom sleeps all the time. Well, I'd rather her be sleeping and resting than to be in a lot of agony and pain, anxiety. So once they learn and they listen, education is so important. The key to it is them learning more about it. But I did find that perception is either one extreme or the other.
Chaplain Brown.
In my experience, I have the same actually experience as Linda with that. I think a lot of African Americans perceive hospice as, number one, just one entity that they don't know that they have a choice of hospice. They don't know that there are different hospices, and so with that, there was a lot of misconceptions, as you all have already stated, about what hospice is, what hospice does, and almost a mistrust of the motive behind hospice. I think we really had not received the information that hospice was there to help not only the patient, but hospice is a huge help and support system for the family when the family is dealing with terminal illness. And so I think that we can get that information across. I think there'll be less misunderstanding and fewer misconceptions about what hospice truly is.
As a former instructor for a class entitled Death and Dying, I would often explain the concept of the horse on the dining room table, that death was just like that horse there. Everyone saw it, but no one acknowledged it. How can we get our community to start talking about death and dying?
Well, I can say one thing is to do what we're doing this evening. We have to engage conversation. We have to take every opportunity that we have to let others know that this is a part of great health care. This is a part of living well. Not only living well, but it allows you to die well. I remember having a struggle with even inviting people to listen to the workshop. I struggled with who I could invite, who I shouldn't, as to what they would think about it. I didn't want to hurt anyone's feelings. I didn't want to, because people think if you talk about it, it's gonna happen sooner. That's not true. And so I think that if we can start, you know, we did a end of life survey some years ago with Arkansas Hospice, and some of the questions were asked about when you grew up. Were you allowed to go to funerals? Did you talk about dying in your families? Did you talk about wills and testaments? There are things that we just don't talk about. We shy away from. And so, if we start, engaging our communities, our healthcare officials, our people in the healthcare profession, social workers, nurses, anyone that can also help spread the word that this is not a subject that we have to run from. This is something that it makes it easier, and more. The more we talk about it, the more comfortable we get. Because I have, like I said, I have that one daughter, and I've made my wishes known to her. I don't want it to come to an end where she has to decide what would my mom want, and does she have to argue with family members about my mom said she wanted a DNR, or she didn't want the DNR. That means do I want to be on a life support? What spiritual rituals do I have in my family? Certain things that, there's a thing that's called 5 wishes that Arkansas Hospice does with families if they're asked, if they ask for. And, we need to let our wishes be known. And so there's not as much discord at the end of life, and that people are allowed to die well. And that term die well does not sit well with a lot of people, but that's what we mean by dying well.
Mm-hmm.
Chaplain Brown, would you like to add anything to that?
Yes, I'd like to add that I think that, again, education is probably the biggest thing that we need to focus on when it comes to breaking down barriers between minorities and accessing and utilizing hospice care. I think we can attack that the same way we attack educating people about cancer and heart failure and all these other different types of illness. Again, through health fairs. I think hospice should be at health fairs. I think hospice should be a topic. There should be information. Our physicians, I believe, can be instrumental in helping minorities to first of all know about hospice, what hospice is, what hospice is not. And early in the early stages after their diagnosis, I believe that education should begin, and I believe that would be a huge help. I think not only educating the patient, but educating the family members. And again, I think what we're doing is awesome here tonight. Also through health fairs, through our churches, through hospice organizations coming to do presentations at various churches and other organizations, civic organizations, blanketing the community so that we are providing the education that they need to tear down again some of the misconceptions and misinterpretations about what hospice is.
Thank you, Chaplain Brown. You have answered part of a question that has come from our audience, and I'd like for you to thoroughly take it a step further, if you could. And that question is: there's some trepidation in minority communities regarding hospice care. Our audience member would like to know, what can religious officials do to educate congregations?
Okay. Again, I think we need to partner with hospice organizations so that we have an open dialogue, we have open communication between hospice organizations and our faith community, and then inviting hospice organizations, inviting social workers, hospice social workers, inviting hospice nurses to come in and to share what hospice is. I think also that it would be awesome if our faith communities can form groups of family members within our faith organizations and faith community who have utilized hospice and people who realize what a great help and a great source of support hospice is.
Do you have anything that you would like to add to that, Ms. Bateman?
I think what he said was correct, and I think the part about adding our our clinical people will makes a big difference, because they can answer a lot of questions that sometimes will help families understand better those medical questions that they need answered. They could go out into the community with those.
Hospice care is a relatively new concept in America. The first hospice hospital was organized in 1974. So how do we address issues of access? How do we inform minority communities about access to hospice care for their loved ones? I know there's more material out there than there used to be, but how can we better address the idea of access for the communities?
Well, I think that if somewhere, say for instance, places where people visit, like doctors' offices, we mentioned the churches, places where they can come in contact with information that they can have before they need it. Accessing healthcare earlier. Sometimes we have people who may not come into hospice until the final days. They may only spend a week, and that's not enough time to get the best quality of care out of hospice. There's no preparation time. And so places where the information can be given out and can be shared, maybe in our hospitals, in our inpatient facilities, in our long-term care facilities, nursing homes, places where it can be shared so that you know what's available before you need it.
That's right. Yeah, I agree, Dr. Shepherd, that generally by the time the family is receiving an info visit about hospice and what hospice is, they just received the news of the terminal diagnosis. Fear has overtaken them. Again, a great confusion. Again, a challenge to their faith. And so those are some difficult things to be dealing with when having to make decisions about hospice and what hospice is. So again, I think the earlier that we can provide education and just help people to understand that hospice should not be something that is feared, that it is something that should be embraced, because it is comfort. It is comfort care. It is not only the medical aspects of the care, but we need to help them to understand that it is a source of support and comfort, again, for the patient's family and their caregivers. There are many times that we actually do counseling, family counseling sessions with the family. There are times when the patient is doing absolutely fine. The patient, they have everything in order. Their mind is made up. They're ready, but the family is struggling to grasp the concept that it's time to help their loved one to be comfortable and again to die well. I agree with Linda that even the concept of dying well is hard for many of us to grasp, because we don't want to die at all. We don't want to talk about death at all. And so, we must do a greater job, I think, of educating and doing that before the need for hospice arises.
A recent survey revealed that 55% of the people surveyed didn't have a clue as to hospice or how hospice is paid for. How is hospice paid for?
Well, there's Medicare, that pays for it, Medicaid, there's private insurance. And at Arkansas Hospice, we even serve people who have the inability to pay.
Right.
And so I know those ways, and there may be others, but those are the ways I'm familiar with.
Anything to add to that, Chaplain Brown?
That really covers it. I think it's important for us to get there that there are not-for-profit hospices, and Arkansas Hospice is a not-for-profit hospice. So we generally don't turn away anyone for hospice care. I think also that we need to help families to understand and help patients to understand what hospice covers. I mean, it helps with medications. It helps with durable medical equipment. It helps with, for instance, oxygen. I mean, those costs are included within payment for hospice care. And so whether that is with a non-profit hospice, whether it is with Medicaid, Medicare, private insurance, and we also have inpatient units where we can take care of family members, and so the resources are there. The resources are there. We don't have to be fearful of the financial aspect of providing hospice care or seeking hospice care, but just reach out for the information. Again, we can do info visits way before the need for hospice arises. And then, as Linda stated, the sooner we can start their hospice care, the more comfortable we can help them to be before they transition. And so I think the key to giving great hospice care is getting hospice involved before the patient becomes critical. Yeah, and let me just add also that, I think the public's perception of what a hospice patient looks like needs to be clarified. We have hospice patients that are still able to get out and go to the store. We have hospice, and we encourage them to squeeze as much quality out of the life that they have remaining as possible. So anything that they're able and willing to try, we encourage them to do it. So it's about not just dying well, but having a quality, adding as much quality to their life as we can, no matter how much time they have left.
And I hope that people who are listening tonight will share this information with others, that they don't have to walk this path alone. And it is a lonely path to lose a loved one. And that these services are here, regardless if you have Medicaid or Medicare or hospitalization insurance, health insurance, or if you have none at all, that Arkansas Hospice will not let you stand alone, but will be there. We have been, I would like to say, modified this year by a pandemic. And the reason I say modified is because I have not found one thing that I used to do that I still do the same today. Everything and every aspect of everything I do has been modified in some way. Has the pandemic made it more or less likely that African American families will consider hospice?
Well, I think it kind of goes both ways. I think that a lot of people are utilizing hospice because they don't want their families to die alone in a facility, so they're bringing them home, and that in hospice offers an extra comfort, extra set of support. And then you may have some that are in a facility and they know that hospice serves as a great communication tool. We can, we're there to be able to relay. We take telephones. We can communicate, allow them to see their loved ones, to have conversation if they're able to. And then you may have some that are reluctant because there is this thing called COVID. And so I know that there may be some reluctancy to allow people in the home. But I think we have found that people are people are utilizing the service. I've seen an increase in the usage of our services.
Chaplain Brown, do you have anything?
Yes, I agree with Linda. I think that in some regards, I think more minorities are utilizing hospice even during the pandemic because they don't want their loved ones to die alone in a hospital. And you know, it's important for us again to educate them and let them know that even when we're coming into the homes, we are following all of these CDC guidelines and some added guidelines for extra care and caution to keep from spreading COVID as we provide care.
Well, we've completed all of our questions for this evening and those from the audience as well. Chaplain Brown and Ms. Bateman, do you have any closing comments that you would like to make to our audience this evening and those who are participating in this workshop?
Dr. Shepherd, I'll go ahead. You know, I just encourage our listeners to get an understanding about what hospice truly is, so that the misconceptions and misunderstandings can be torn down. I encourage our listeners, I encourage everyone to thank God for hospice. Thank God that in him being the God of all comfort, that he provides care, not only medical care, but spiritual care within the home when the patient can no longer go to church, when their caregiver can no longer get to the church. He has provided a means through hospice that they can still receive spiritual care and spiritual support in their home. And so, again, you know, finally, I just say, don't be afraid. Don't fear hospice. Embrace it.
All right. Thank you for those closing comments that are very encouraging as we face, and each of us will face this in some aspect of our lives, either for others or our families for us. So we will face this. I want to say thanks to the Arkansas Hospice Foundation and the Minority Outreach Coordinator, Reverend Kyle Jones, for their coordination of Black, Brown, and the challenge of dying well. Thank you, Ms. Bateman and Chaplain Brown, for your words of encouragement and for sharing with your expertise that has been both professional and personal. And we thank you, and for all of those who watched tonight. I would like to thank the Rebsamen Fund for making all of this possible. And you may visit other pages of arkansashospice.org. Feel free to call or email with additional questions that you may have about symptom management or end-of-life care. This is the third of 4 workshops on this topic that will be held in the coming month. Our next area will be Central Arkansas, and we invite you to be a part of that conversation upon notification of that date and location. So for now, I'm Lewis Shepherd Jr. Good night. Thank you for joining in, and may God bless each and every one of you, and go vote tomorrow if you've not already done so. Good night.